This campaign of sabotage started in January and has extended until today, and we are now starting to see the results of that campaign of sabotage. It starts on the Inauguration Day when President Trump signs an executive order ordering all of his agencies to dismantle the Affordable Care Act. It finds its way to the Senate floor when Republicans spend most of 2017 trying to pass legislation that would take insurance away from 23 million people, according to CBO. The president undertook a number of steps to try to weaken the exchanges where millions of people get their health care. He cut the open enrollment period in half. He stopped funding advertising. He pulled funding for the navigators, the people who go out and try to help people sort through their healthcare options. There's no reason to do that, to try to stop people from being able to sign up for healthcare, unless your intention is sabotage. There's no public policy reason to give people less time to sign up or to give them less information about their options. And most recently, the Republicans finally succeeded in repealing the individual mandate, which the Congressional Budget Office says will by itself increase premiums by 10% and wipe out insurance for 13 million people. And the administration is now trying to expand the sale of what we call junk plans, which are insurance plans that don't have to cover a minimum set of benefits, that don't have to protect people with pre-existing conditions or existing sicknesses from higher premium rates. I came down to the floor, I think 2 weeks ago now, to talk about the first two rate filings of the rate filing season. These were in Maryland and Virginia. The rate filings were, quite frankly, catastrophic. These were the worst of the bunch. All of the rate filings were much higher than the rate of medical inflation. The worst requested increase was one insurance plan in Maryland asked for a 91% increase in premiums. One insurance plan in Virginia asked for a 64% increase in premiums. In Maryland, the head of the insurance plan that asked for the 91% increase said that the reason for it was the continuing actions on the part of the administration to systematically undermine the market and make it almost impossible to carry out our mission. No one can afford a 91% increase in premiums. No one can afford a 64% increase in premiums. But frankly, very few people can afford a 15 or 20% increase in premiums. And this week, we got the rate filings from the state of Oregon. And in Oregon, Providence Health Plan with about 90,000 customers, which is one of the bigger plans in the state, is asking for a 14% premium increase. Now, that's not 91 or 64, but there are a lot of families who simply aren't going to be able to afford a double-digit premium increase in Oregon. It's important to note that Oregon put into place a new state-based reinsurance program, and if not for that reinsurance program, this would have been a 20% increase. So I'm just going to keep track of all of these increases so that we have a sense of what is happening to consumers as a result of this campaign of sabotage. And so we will add this rate increase in Oregon, make sure that I get it right, of 14%. CBO has told you that the repeal of the individual mandate is going to jump premiums by 10%. So in Oregon, you can be relatively sure that had the Republicans not repealed this big part of the Affordable Care Act, you would have been looking at a single-digit increase, something that mirrored medical inflation. But because of the actions that were taken here, and because of many of the actions undertaken by this Congress, we're looking at a double-digit increase. Keith Forrester, who is the head of one of Oregon's biggest insurance companies, says that our rate increase reflects the expected costs of providing coverage to our members, including the impact of eliminating the individual mandate. Senate Democrats are going to be down on the floor pretty relentlessly over the course of the next few months to make people understand that as you are getting your health insurance bills, as you are seeing these big increases, a big reason why are the actions that your elected leaders have taken, this Republican Congress and this administration. But the rate increases might be getting even bigger than they already are today. That's because of this expected proliferation of these new junk plans. Now, again, these are called by the administration short-term plans because they used to be truly short-term options. They were 3 months in duration. You'd pick up one of these plans in between coverage. And because they were short-term plans, they weren't required to cover mental health and maternity. They could charge you more if you were sick. But this administration has decided that now these plans can be sold for a full year, meaning they're essentially going to stand side by side with regulated plans that have minimum benefits and protect people with pre-existing conditions. The administration said that only a couple 100,000 people nationwide might sign up for these plans. Well, CMS's chief actuary, this is President Trump's CMS, the administration's own chief actuary, says that that's wrong. In fact, it'll be 1.5 million people potentially signing up for these junk plans. It could get as big as 1.9 million by 2022. And who will sign up for these junk plans? It'll be healthy people, because healthy people aren't going to need all the coverages. It'll be people that don't have a pre-existing condition, that don't have an addiction or a diagnosed mental illness, leaving behind in the exchange plans people who need the coverage. Those people won't go on the junk plans because they need an insurance plan that covers their illness or their diagnosis. And so what we know is that if you have a sicker population in the exchange-based plans, in the individual market, in the regulated individual market, those premiums will go up. A recent study said that the combination of the individual mandate and the proliferation of these new junk plans will result in, on average, 16% increases all across the country in premiums. In Connecticut, that could mean that premiums go up by $1,155. Now, that's not something that the health insurance companies did. That's not because of rising medical costs. That's because of decisions that were made by this Republican Congress and this Republican administration. 2 decisions. One decision to repeal a big part of the Affordable Care Act that protected sick people, that kept their rates lower. Another decision by the administration to give relatively healthy people access to stripped-down plans. Now, admittedly, those 2 changes may offer some benefit to people today that are healthy. I'm not going to deny that those 2 changes may provide a lower insurance rate for a subset of people that are healthy, but we're not supposed to just represent the healthy people. And today you are healthy, tomorrow you are not. We are supposed to represent all Americans. In fact, we probably should be going the extra mile to make sure that people who, through no fault of their own, have a serious diagnosis aren't paying an arm and a leg more for coverage. But we're not doing that because of the steps that this Republican Congress and this Republican president have taken. Insurance rates are going to go up for everybody, on average in Connecticut, by $1,100, according to one study, and they're going to potentially skyrocket for people that can't get on to these stripped-down junk plans. So, Mr. President, I just think it's really important we talk about this. As I walked across the state of Connecticut last summer, something that I've come to do the last few years, I take about 5 or 6 days and I walk from one side of the state to the other, something that the presiding officer and others probably can't do in states that are a little bit longer across than 110 miles. Healthcare was the dominant theme. People were waiting for me miles ahead on the road, having seen news that I was in a certain town earlier in the day. They waited ahead of me for hours and hours to talk to me about their illness and about their fear that this Congress and this president were going to take away their coverage. We were successful in defeating the full repeal of the Affordable Care Act. And that's great news because the Affordable Care Act is more popular than ever before. But this Congress and this president are trying to ruin some of the most important protections in our healthcare system because they're mad that they lost the repeal vote by 1 vote. And so it's important for us to tell Americans what the consequences of that sabotage campaign are. It certainly means that sick people are going to get less protection. But it also means that over the course of the next few months, as rates are filed across the country, you are going to see some devastatingly high premium increases due to the Republican campaign of healthcare sabotage. This week, 14% in Oregon. Last week or the week before, 91% in Maryland, 64% in Virginia. This is what happens when you strike blows at the American healthcare system. And it's important for Americans to understand what's happening. With that, Mr. President, I'd yield the floor and note the absence of a quorum.